Well, Sitaram, and pleasant good morning to all of our viewers and listeners, and welcome to another edition of the program Addiction and Recovery. I'm your moderator this morning, Jason Kalu. Join me as we welcome the host of the program to Addiction and Recovery, Mr. Ramnir Dwarka. Sitaram, please, sir.
Jason, and thank you very much for having me on the program. Let me join you in welcoming all our listeners, both locally and internationally, those online as well. And I want to remind our listeners that this is an interactive program, of course. You are quite welcome to call in and ask a question about the subject matter, or, you know, you can also share an experience that you might have had briefly in drug addiction and that and recovery. So this morning, Jason, I want to thank the staff for sourcing that video that they played earlier on. Very valuable information, and it kind of recapped what we spoke about last week. The predisposing causes, the precipitating causes, the perpetuating causes of drug addiction, and also suggested some very effective methods of treating with drug addiction. And this morning, I want to speak about one particular method that really is, I would think, a method of choice. And that is the use of acupuncture in the treatment of drug addiction. And there's a little story that goes with this, Jason. Way back in 1992, I was working as a psychiatric social worker at the Substance Abuse Prevention and Treatment Center at Cora Hospital. And as you all know, and our listeners know, I am also a person in recovery, hence my passion for working in this field. And I was on my way to Port of Spain in Trinidad to a stress management program at St. Anne's Hospital. Now, I have worked at St. Anne's Hospital I also worked at the psychiatric unit of the Port of Spain General Hospital. And later on, I would have worked at the Ward 1, which is also the psychiatric unit of the San Fernando General Hospital. In my course of career, I've worked at most of the psychiatric clinics in Trinidad and Tobago and the various districts. I'm saying that to say that I have a very wide experience out there in the field, and I have a very good idea what works and what does not. And traditionally, we have been using chemotherapy. That is the established protocol for treatment when a person comes in for drug addiction and they are suffering with withdrawal symptoms. So coming back to my story, I was on my way to the stress management program at St. Anne's, and I heard that there was some gentleman, an Englishman named John Tyndall, who was teaching acupuncture at the Jean Pierre Sports Complex. And some of our staff from the same unit, substance abuse unit, had gone to attend that. And I wondered what acupuncture has to do with drug addiction, as indeed most of our listeners would probably be having the same thoughts I had. Because basically, I'm a born skeptic. I don't accept things easily because people say it doesn't matter who, or even if it's written anywhere. I usually depend on my own personal experience with things. So I said, no, I had to go and see what this had to do with drug addiction. Because being a person in recovery, I was always passionate. I had looked at our methodologies, using standard methodologies for treating drug addiction worldwide and indeed in Trinidad, where a person comes in and we prescribe chemotherapy tablets and so on for them to deal with their depression and their anxiety and all the classic withdrawal symptoms of insomnia, irritability, anxiety, depression, and all of those things. And it did not take me long to realize that you really cannot use drugs to effectively treat drug addiction, because what you're basically doing is substituting the solid sedatives, that is the tablets, for the liquid sedative, which is alcohol. You understand? And I also saw that a lot of people who showed up for treatment were people who were now using alcohol and other drugs, psychotropic drugs, in conjunction with their medication. Because at first, they may have gone to their doctor, the psychiatrist, presenting with insomnia or depression or anxiety, and they would have been prescribed with these psychiatric psychotropic drugs to help them, the tranquilizers and all of that. But then we know, Jason, that the body becomes resistant to these. They develop tolerance. And after a while, if 5 milligrams don't work, you have to go to the 10 milligrams. And then if we fast track at some point, the medication is not helping you to sleep or deal with the depression or the anxiety. And that's when a lot of people start switching to other substances, the alcohol and the marijuana and the cocaine and all of those things. And now you really have a big problem. One with the illicit drugs and the prescription pills as well. And I've been seeing a lot of upper middle class families, people, from that kind of background, who would have, their first line of defense would have been to go to their doctor and be prescribed these medications, now showing up with dual polydrug substance abuse in my office here and in the clinics. So I was curious to see, well, what is it this acupuncture had to do? I went, I participated in the program. I did the training, which lasted just 2 days, learned the needling skills and all of that. But in the process of the training, Jason, you had to have a treatment. This is how the training is done. You pair off with another person. And when you learn the needling skills, you put 5 needles on the air and they put 5 needles on yours to practice and to demonstrate whether they have now learned the skill, which is not difficult. But in the process, you are getting a treatment. And my body was telling me that the full evening, hey, when last you felt like this? Because being a person in recovery, and I don't really take prescription pills unless it is really life or death. My body is very sensitive. And I felt so relaxed. And it is only later on I would realize when they put these needles, it causes the brain to release a chemical called dopamine. And that is what really makes us feel happy. Even if you got a compliment or you got good, you won the lotto or, whatever made you happy, you got an award and you felt happy. The ability to feel happy is because the brain released a little bit of dopamine. And that is the same thing the alcohol and the other drugs do. So now the acupuncture was doing that. So you did not have the need for the alcohol or the drug. So it did not take me long to realize, hey, here was a good option. But again, the skeptic that I was, I couldn't after 2 days believe that such a simple thing could cause such a profound benefit. I saw the potential of it. Going forward, people may not need all this medication and all of that. And the nice thing about acupuncture is you can't get addicted to it. There are no side effects. So I thought, well, I had to go and see where this, do more research. And then I went to the clinic in the Bronx at the Lincoln Hospital where it all started. Actually, acupuncture has been around, according to the chronology of it, about 6,000 BCE. It's recorded in China. And some people are also of the opinion that it might have been derived from Ayurvedic medicine. Because today, as an acupuncture practitioner, I'm also certified not only to practice acupuncture, Jason, I'm also certified to teach it as well. And I have trained a lot of acupuncturists who worked at Cora Hospital. I've trained some doctors as well to do acupuncture in Trinidad. Unfortunately, just a few of them do actually practice acupuncture alongside the conventional medicine. But I went to the Bronx and I met with Dr. Smith, who had introduced the use of acupuncture in the clinic there because they had had a severe heroin problem in the United States, in New York. And they had started to use methadone as we would have used the sedatives here, as I mentioned earlier, around to deal with the severe withdrawal symptoms of heroin. And now they were finding that people were becoming more addicted to the methadone, as indeed I have seen here people who were prescribed psychotropic drugs to help them with their withdrawal symptoms from alcohol and marijuana and cocaine, now getting addicted to the sleeping pills and the tranquilizers and all these psychotropic drugs. And this really, I mean, was something that, and I'll tell you from experience, it is several times more difficult to come off prescription pills than it is to come off the alcohol and the marijuana and the cocaine, because these pills are researched and they are administered in such a graduated way that you are guaranteed to become dependent on them. Now, as I say this, I want to have a word of caution. I'm not suggesting that people should not go to their doctors and the doctors should not prescribe these medications. However, what I'm saying is that doctors who prescribe these psychotropic drugs, they have a responsibility to work out an exit plan with their patients, because nobody should be put on any psychotropic drugs for the rest of their life. We need to look at the other methods, you know, the counseling, the psychotherapy, and in this case, acupuncture as a very viable option, instead of having the person now be exposed to a more severe addiction, one in which they will not be able to be rehabilitated very easily in the future. So getting back to my story, I went to the Bronx. I met with Dr. Smith, and I was asking him so many questions that he asked me at the time, you know, jocularly, he said, "Are you a social worker or a policeman?" So he said, "Look, go downstairs." The clinic was being run downstairs of the building. And when I went down there, I saw more than 100 people who were heroin users, marijuana users, cocaine users, alcohol abusers. They're all sitting very calmly and quietly with needles in their ears, 5 needles on each ear, very small little needles. That's what is called the NADA protocol. NADA is the National Acupuncture Detox Association. Incidentally, I was the first chairman of the National Acupuncture and Detox Association of Trinidad and Tobago. And we had people like Dr. Collymore, who was also a member. We had several doctors who were on that committee as well with me. And I spent some time there in training as well and working in that clinic. And I satisfied myself that acupuncture did in fact work, from personal experience, from empirical evidence. And I came back to Trinidad and I sought to introduce it at the Cora Hospital. Well, Jason, I met with so much opposition. There seemed to be a natural resistance, even among medical professionals and you know, people working in the helping profession generally. I don't know if it is because of professional jealousy or what. A lot of doctors, it seems to me, found that how a simple thing like this could be so profound until they themselves had to be involved and see. And I've had that experience. I remember there was this one guy who came from, elderly gentleman who had come from El Socorro one morning at the clinic, and myself and Dr. Bisesa, Chandan Bisesa at the time, was running the clinic at Cora. And this man was shaking violently, you know, and Dr. Bisesa, who was new to the setting, he mused that it might be Parkinson's this man have. I said, no, that is not Parkinson's, that is the shakes, because he drank up to the night before. And this is one of the classic withdrawal symptoms, when the hand is, you know, shaking. And we had him sit in one of these old Morris chairs, we call them, with the sidebars, you know, so you can't fall off. And no sooner I had administered the acupuncture on his ears, by the time I had finished the second, put it on the other ear, all the shakes had disappeared. And he said to me, if he had not seen it for himself, nobody would have been able to really tell him, and he believed this could ever happen. And as I say this, I want to cite a study that was done in 1989. It is published in the Lancet magazine on the 24th of June, 1989, volume 333. They were testing the efficacy of auricular acupuncture in the treatment of drug addiction. And they were testing to see if it was just a placebo. You know, there's certain drugs that have a placebic effect. Whether it work or not, if you believe it would work, it would work. To see if people, if you believe the acupuncture would work, it would work. And the study clearly showed whether you believed in it or not, it worked. The success rate was very, 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 very encouraging and rewarding. So I came back to Trinidad and I sought to introduce it at Cora Hospital. And I met with a lot of resistance, even from my own colleagues, because we had just had the eggnog problem at St. Anne's Hospital. And so the medical staff were up in arms. They were not willing to try anything new. However, I had to do a lot of presentations, and it was suggested that I should do a study here in Trinidad at Cora Hospital before they will accept it. And so I did a study in our outpatient program. And what I found, just to summarize, before the introduction of acupuncture, less than 50% of the people who came to the outpatient program stayed sober. In fact, they'll drop out. More than 50% will drop out before the 6-week end of the program. With the introduction of acupuncture, now 80 to 85% was completing the program, and more than 60% was actually staying sober. I wrote up the study and I did the presentation, and eventually, to cut a long story short, Dr. Lewis, who was head of the consultant, he incidentally had been to a seminar hosted by CICAD in South America, Brazil, and he had heard about the use of acupuncture, and he said he was so proud to mention to them that, look, his center in Trinidad at Cora, we were now using acupuncture to treat drug addiction. And when he came back, he gave instructions to all the staff that he was now taking responsibility for the acupuncture program. And then I must say to Professor Bobran, who has been an authority in substance abuse in the Western Hemisphere, he was the person who eventually got the breathalyzer legislation passed, Jason, in Trinidad and Tobago, because at one time he was an independent senator. And Professor Bobran, who was the head of the Caribbean Institute on Alcoholism and Drug Addiction, he eventually invited me to become a resource person at that institute, where I did volunteer work for 25 years. I would go every year to the institute and I will do presentation, and I would do demonstrations of the use of acupuncture to people of the helping profession, doctors, nurses, and social workers, and so on. So to say, today, I think worldwide, the World Health Organization has now accepted acupuncture as an effective method to treat drug addiction. So too, a lot of the other health authorities around the world have accepted it, and it has definite advantages. I actually have been practicing it in my own private practice here since 1992, and I have not only moved from treating drug addiction, I have done generalized acupuncture so I can treat with things like stroke and arthritis and lower back pains and insomnia and depression and anxiety, a whole lot, a range of issues. So just a little bit about acupuncture. It is very cost effective. In fact, it is cheaper than any other treatment modality you could think about currently. It is also very safe. As I said earlier on, you cannot become addicted to acupuncture. It has no side effects. And one of the there are several definite advantages over contemporary methods. One is, if a woman is pregnant, Jason, we don't have any chemo drugs that we can really give them to treat them for their withdrawal symptoms. If they were pregnant and they were addicted to alcohol or cocaine or marijuana, any of those things, we could not give them the usual psychotropic drugs that we use to treat other drug addicts, because the drugs it is not safe for the fetus. it can affect the unborn child. But acupuncture can be used successfully to help pregnant women to deal with their withdrawal symptoms. Another definite advantage is that you can use it with the mentally ill, chemically addicted person. MICA, they call them, for want of a mnemonic, mentally ill, chemically addicted, because the mentally ill person may not respond to counseling, Jason, because they probably can't understand what is going on. You know, they are out of it, they're mentally ill, they sometimes they might be schizophrenic and so on, they're not even aware of what is happening around them. So you can't reach them with the psychotherapy, with the counseling and all of that. But you can definitely reach them with acupuncture, because once you put the needles, whether you believe in it or not, it works. And that was my experience as well, because I was very skeptical. I couldn't understand how putting 5 needles on my ears would help me to stop drinking. In fact, I thought at first, if you cut off my ears completely, that would not have changed it either. I could still drink until I went and had the treatment. And I have worked since 1992 with alcoholics and drug addicts. And what I've also found in very early in 1993, when I started my practice, I found a lot of women coming to the practice who were going through menopause, and found this to be a very effective way, because women who are going through menopause, you know, they have all kind of severe mood changes. Some of them become very claustrophobic, they become very irritable, they have hot and cold flushes, and there is the normal conventional method of treating with that is to put them on hormone replacement therapy, HRT. But we know for sure that hormone replacement therapy causes cancer. So it is a serious thing. So that, again, acupuncture was found to be a very useful option, so that you don't have to run the risk. And it's very effective in treating the mood swings and all of that associated with menopause. I have, in fact, I started off with auricular acupuncture, but I have gone on now to use acupuncture to treat people with stroke. In fact, in my humble opinion, I feel acupuncture is the most effective treatment for strokes right now that we have available. Yes, if you're living in the New York area and in certain parts of the United States, maybe Florida, and you get a stroke and you can find yourself to a hospital within 24 to 48 hours, they can actually drill a hole in your head and remove the clot and save you. Aside from that, there's no real treatment for stroke. All you can do after a person has had a stroke, the doctors can do, is to help you to manage your high blood pressure so you don't get worse or you don't get a second stroke. And you know, protect the body from, and giving the body a little time, you know, to try to reconnect with those nerves that were compromised. But acupuncture has a definite advantage in that it can trigger the nerves from the extremities. There are electrical stimulations that when you put the needle, you can connect, and it can test to see how compromised the nerves are. And it can also trigger the nerves to reconnect with the brain. And I have had very, very successful outcomes with people with stroke, especially if you take it very early. Unfortunately, a stroke is a very serious thing, Jason. And most people, as they get a stroke, they try to go to the best doctors. And, you know, in Trinidad, I don't want to call names, but you have a few people who have been labeled as stroke doctors, you know, in different parts of the country. And people go and they try their best. You know, they give them vitamin injections and all of that. And it helps. But I'm saying in terms of efficacy, I have found acupuncture to be very, very effective. No. However, it may not you may not recover completely, but at least you can regain a certain level of mobility in a quicker time. But coming back to drug addiction, the use of acupuncture and drug addiction, it was used at Cora Hospital while I was there, and even after I left in 2000. And I know it used to be used, it is still being used at the New Life Ministries. I was the person who trained the first batch of acupuncturists who did the treatment at Mount St. Benedict New Life Ministries. And I recall actually at the graduation, Professor Bourbon did the honors of coming and giving out the certificates to these acupuncturists. And I must say, he was a man of great insight. Even though a doctor, and he had the courage of the confidence, to take acupuncture on board as an adjunct to treatment. Now, as I say that, Jason, acupuncture is not a cure for drug addiction, but it's one of the tools in the toolbox, as it were, one of the options, very useful options to treat with drug addiction, because you are able to cut down on the use of medication that has the potential to have people now become addicted to the medication, but they cannot become addicted to the acupuncture.
But in
Yes.
in terms of okay, that it is seems to be a solution, but can anyone do acupuncture themselves? Because nowadays, if you Google or you go on YouTube, you can find a demonstration on how to do a lot of things. So is it safe for someone to do themselves, or do they need to go to a professional to do acupuncture?
I'm so happy that you're asking that question. Yes, a lot of people look at it and think, well, look, man, I could just take a needle and put it. No. That is not correct. It has to be done under supervision. You have to practice. You also have to understand the theory behind the use of acupuncture. You have to understand that there are 12 meridians that run through the body, and you have to be able to find these acupuncture points. And they are so microscopic that you have to be very precise, because if you miss the point for the kidney on the air, you will be treating the large intestine. You would, rather than treating a person for drug addiction, you might be treating them for constipation instead. You understand? And it has happened actually, I'm aware of it. Something that happened at Cora Hospital, but I don't want to take time to tell you about that. Fact of the matter is that it must be done. The training is very precise, it's very specific, and the training is not just putting needles. It is, you have to know where you put in the needle, and you have to be, most important in acupuncture is not so much the treatment, is the diagnosis. Finding out what has led to that condition. And if we are treating drug addiction, just putting the needles will not treat the problem. You have to, and that's one of the definite advantages that I would like to say that I have, because being a person in recovery, also being trained in social work, and having the experience working in the field, and having the training of acupuncture, also to be able to teach it, it definitely has given me a certain advantage in working with this problem. And since 1992, I've worked with thousands of people with not only alcohol addiction and marijuana and cocaine, but I've helped people to stop smoking cigarettes. I've had people who come, people who break out in a rash when they're stressed out, and I've been able to treat with those patients as well. A lot of people with anxiety and depression, even people generally, I've had patients who, before they go to play a golf match, come and have a treatment just so that they be calm and relaxed and more focused. So acupuncture has a lot of application, and it is safe, but it is, yes, as you rightly said, it's not something that can be just done by anyone. You have to be trained, you have to know what you're doing, and you have to be very specific with the points.
Mm-hmm.
And yes, I mean, there's a lot of, as I said, it has a lot of application. And I had mentioned earlier on, it is very cost effective, in that at Cora Hospital, for instance, we had calculated, since we could reuse the needles, you would buy new needles, we'd use it, and then after use, we'll send it to the autoclave, which is the steam barrel. In the hospital, they have all these hospitals, the major hospitals have what you call autoclave systems that they are able to treat with surgical instruments and so on, to make sure that they are not contaminated, to sterilize them. So we would have the needles sterilized, and the nursing assistants would package them back again in sealed packages. Once we open a package, if we don't use it, those needles that remain go back for re-sterilization. And the program was self-sufficient because in a little while, the patients who were coming, the patients were having acupuncture. Their family was having acupuncture as well. The staff was having acupuncture at the hospital because they all found it to be beneficial. It helped them with depression, anxiety, insomnia, stress. And they would put a little money, I will tell them your relapse money, put it in that little container there, like a savings box, and we would use that to buy new needles. And the program was self-sufficient. And if I had also given an incentive to patients who were in recovery, once you were 2 years sober, you could come and have the training and be trained in acupuncture because you're already in recovery. You would have had first-hand knowledge. So I've trained them on the theory, the thinking behind it. There are 5 long points that are treated on the air that is called the NADA protocol, specific for treating addiction generally. And that one is it's called Shenmen, which is really at the base of the spine on the air. Our whole body is represented in our ears, Jason. If you look at somebody's ear, you'll see it's a fetus upside down. And there's a ridge here that if you run your fingernails on it, you'll feel it joint. Those are actually your vertebrae, So I can palpate your ears and tell you whether you have a problem anywhere in your spine or your neck. I can also diagnose from looking at certain things on your ears. I can also, now you've heard about reflexology, where you can, all the points of your body is represented on your hands and your sole of your feet. And there are people who could just massage your hand and your feet and give you a treatment. And then, so you have iridologists who can look at your eyes and make diagnosis. You have people who could look at your tongue and make diagnosis. You have the Ayurvedic doctors in India who will just look at your aura and make a diagnosis. And I use all of these methods that are familiar to me to verify the diagnosis. When I speak to a person, I listen to them because of my counseling skills. I can do psychological and psychiatric diagnosis from my experience and training. But I also use these other methods to look at their hands and their ears to confirm what they are telling me. And my emphasis is not only on treating the person. It is not only on giving them a fish, but it is in the course of diagnosis, evaluation, to help them to realize where they went wrong in their lifestyle, to recognize and develop insight into where they went, how they started, why they started to use drugs, or what they were doing or not doing that caused them to have the lower back pain. You understand? Their posture and their structure and all of that, so that my aim is to rehabilitate rather than give a fish, to teach people to catch fish. So that if after one intervention with me, if I could help you so that you don't have to come back to see me, you can now take care of yourself. That is my emphasis in treatment. And I must say, I don't advertise, I speak about it on this program, but a lot of the people who come to see me are usually people who were told by others who had come to see me and have had good results, So coming back, I want to let our listeners out there know that you have options available. In Trinidad, especially for drug addiction, you have now there's a lot of people out there who know that they have a problem with alcohol and drugs. And secretly, they have been trying this. I know that when they come to see me, I know how much attempts they would have made. First, they would have promised their family they will stop, and then they would have failed. And then they stopped promising people like I did and tried on their own and failed. And then they reached to a point of frustration where they stop trying. And they start rationalizing, They come to the point like I used to say, boy, I don't play cricket. I don't play football. I don't gamble. So if I take a few drinks, what's wrong with that? And I actually believe that. And that is what perpetuated my drinking and drug use. Because I did not know that there were other options. And so today I know. And this is what we are offering on this program, Jason, our listeners, that there are other options, no matter how bad you have gone. This is the one illness, the worse you are, the better you are able to stop. The more ready you are. Because the ones who are just started and enjoying the drinking, they have no intention to stop, even though it is causing problems. But the ones who have really hit bottom, they are more ready. They're more likely to accept what we are saying here. And anyone listening to this program, if you believe that you need to stop, if alcohol and drugs are causing problems in your life, even prescription pills now is taking you to a point where you have become chronic dependent on it, then you can call. My number is listed on the program here. You can call the station. Even if you're not in Trinidad, you can get in touch with me, and I would I can direct you to resources in New York, in Florida, in wherever you are in the world. I will be able to guide you as to what you can do, because there are AA meetings in 189 countries in the world now, Jason. Most of the developed countries, they have treatment facilities for those who could afford it, and even for those who can't afford it.
But in
I
terms
did training, yes.
in terms of acupuncture treatment, right? Based on your issue and your diagnosis, you would need a certain amount of sessions. Now, in terms of getting the best results out of acupuncture, is there anything else you can do along with acupuncture, like meditation, to get the best results?
Definitely, Jason. That's a beautiful question, because acupuncture, as I said, is a useful adjunct. But there are other modalities that the person will have to access. One is counseling. If you let's suppose you're addicted to alcohol or cocaine or marijuana or prescription pills, and you want to come off those, psychotherapy is important. That is, you need to be counseled. You need to now be taught other coping skills, because you would have become dependent on alcohol and drugs to help you to cope with your depression and your anxiety and all of those things. So you have to be taught these coping skills. Now, alongside with the acupuncture, and yes, meditation is also a very powerful modality. In fact, one of the steps that is used in Alcoholics Anonymous, step 11, says we sought through prayer and meditation to obtain conscious contact with God as we understood him, praying for the knowledge of his will for us and the power to carry that out. I also read a book written by a very prominent psychiatrist, Dr. Andrew Weil, who was chairman of the American Psychiatric Association, and he wrote a book called The Natural Mind. Anybody listening, if you can access that book. And to summarize what he said, one of the essential points he made in that book is that he saw so many people give up drugs to take up and took up meditation to keep them off drugs. But he was yet to see somebody give up meditation to take up drugs. Because once you get introduced and you start doing meditation, you don't need drugs anymore, Jason. In fact, that's one of the most important activities I do every day, my meditation in the morning. And just let me say this, one of you see, the attraction of drugs is that it can take you to a place where you insulate yourself against stress and all these other problems of the world. You can get into a zone, right? Drugs can do that when you become euphoric. Sex also do that when a person in the orgasmic state, they don't know what day it is or where they are. It is so, euphoric. But meditation does the same thing, and is not going to cause you any problems of withdrawal and side effects and all the remorse and all of that. And unlike the other activities, your sexuality can lead you into problems as well, relationship problems if you're stepping out. So, because there's such a thing as sexual addiction as well. And the same 12 steps that is used in AA has now been found to work effectively with people with alcohol, marijuana, cocaine, cigarettes, Overeaters Anonymous. There's also Sex and Love Addicts Anonymous. using the same principles. And acupuncture can not only treat physical problems, it also has psychological effects. It can be used for even the behavioral addictions. Because a lot of people, actually, one of the initial reasons the auricular protocol was used by a doctor in Shanghai was to help ladies who wanted to lose weight. Because a lot of people, Jason, they do what is called comfort eating. As soon as they get stressed out, they want to eat things, and they want to eat sweet things, and that is how you put on weight. So acupuncture can also help people to lose weight as well. And so could meditation. When I counsel people who want to lose weight, I suggest to them to get involved in not only physical exercise and looking at their eating habits, but also meditation has been found to be a very effective way in helping you to deal with the munchies, as they call them. The people who are constantly eating, to help them to deal with depression and anxiety and all of those things. Especially they go for the chocolates and the ice cream and so on. So that acupuncture, I mean, there's so much more can be said about it. I've tried to put it over in a very, up to now, actually, no one, including myself, I can't really tell you exactly how acupuncture works. Like, I still can't tell you exactly how my car works, but it never stopped me from using it. You understand? So I'm not going to wait until I know exactly how something works before I use it. Once it works, and bottom line here, Jason, if it has been used for 6,000 years, it has been using up to now. If you use a tool once or twice and it didn't do the job, you're not going to use that tool anymore because it's useless. But if we're still using it up to today, I mean, for crying out loud, there must be something about it that is working. And that is the mindset I went with. I wanted to find out, what is it? Does this really work? And to my great, surprise, it did in fact work. And I'm so happy that it did work, that today we have a very viable, safe option to treat drug addiction. And before we go, I want to say that you don't only have to use needles. The auricular acupuncture can be done without needles. There's a little machine. I have one of them right here. It looks like this, where you can do, it's called electroacupuncture. I don't know if you can see this. And then there's also what you call migraines, a little seed that you can put on the points and press them. There's little steel balls as well that is encased in a little piece of sticky, like sellotape, that can be placed on the points. So for people who are afraid of needles, you can also use electrical stimulation now. And it is not really painful. It don't hurt like injection needles. In fact, if I put the needles for you, Jason, you will not even know when I put the needle. There's a technique, and you must need, and this again, you must be trained in the needling skills to be able to do this. So I know that, when we're having these discussions, we quickly run out of time. I see it's getting to that time, that we have to round off. But I want to say to all our listeners that if you have a problem with drug addiction, addiction has been recognized as a disease now in the world, and nobody can't blame you or fault you for being sick. It doesn't matter how it started. You might have started it as recreational use and so on, but eventually you become compulsive, and you become addicted, and you need help. And help is available. There are many options available. As I said, you have counseling, you have psychotherapy, you have detox using acupuncture. And yes, in some places they use chemicals, chemotherapy. And nothing is wrong with using chemotherapy if it is used and managed in a responsible manner, And of course, there's meditation, and there's the Alcoholics Anonymous program that is worldwide, that is the most successful program in the world to date to help people who have an alcohol or drug problem. it is, as I said, it's in 189 countries, and we are fortunate, Jason, in Trinidad, that we have the most AA groups per capita than any other country in the world. And it is thanks to the efforts of people like Professor Berbrand and the early members of AA who really evangelized. In Trinidad, we don't wait till people call. As a person gets sober, they rush out there and they start looking for all their drinking partners and start inviting them to go to AA meetings because they quickly realize, here is a place that can save your life, save your family life. And when one alcoholic stops drinking, is not only he benefit, the family benefit, the neighborhood benefit, in fact, the nation benefit, the world benefit as well. So I might place myself as an example. I stopped drinking. If I was still drinking, we were not going to have this conversation this morning, Jason. I'd probably be encouraging you, let's go take one, boy. It's raining outside. You understand? So I'm really happy to be on the program again and to have shared the information
Yes.
of public. And of course, my number is there. Anyone wishing further information on this subject can call and get in touch with me. So I want to thank you again, Jason, and I want to thank Francis and the staff in the back room there for putting together the little videos and all of that to enhance the program and make this a very useful and effective program. Thank you again.
Well, thank you for always taking the time to do this program. And like Mr. Dwarka said, to every addiction, there's a solution. It only takes that one step. Until next Thursday, I am Jason Glu saying, see you around.